Good afternoon, ladies and gentlemen. I'd like to tell you the clinical significance of the radiolucent shown around the pedicle screw in the lumbar degenerative disease. Pedicle screw has been introduced in the 1960s and used widely since the 1980s. Pedicle screw fixation can be useful in the surgery of lumbar degenerative disease by increased post-operative stability and bone fusion. Clear zone is observed on plain radiography during the post-operative course in many patients. That has been disadvantageous for osteosynthesis, and their presence indicates loss of the fixation. Many aspects of the clinical course and pathology about clear zone are unclear. So we retrospectively analyze the clinical significance of the radiolucent zone surrounding pedicle screws. 390 cases was objective in study. Average follow-up period was 47 months. Average age was 60 years old. The diagnosis of spinal stenosis was 293 cases. Degenerative spondylolisthesis was 17 cases. Previous spine operation, 67 cases. Posterolateral lumbar fusion was operated in 380 cases. Posterolateral lumbar fusion with posterolumbar intervertebral fusion was operated in 19 cases. One-level fusion was 85 cases, and two-level fusion was 187 cases. Three-level fusion was 107 cases. We have used Aegis implant of Corentec in Korea. Evaluation of clear zone. 1 mm or greater circumferential lucency around the screw on plain radiograph from 2 or more directions was judged clear zone positive. We investigated at 6 months, 1 year, and 3 years after surgery. Assessment of bone union based on intervertebral mobility on flexion and extension radiography. Pseudoarthrosis was diagnosed when it was more than 2-degree range of mobility in posterolateral lumbar fusion and 1-degree range of mobility in posterolateral lumbar fusion with posterolumbar interbody fusion. Result. Relationship between clear zone and follow-up period. 6 months, 31% was clear zone positive. 1 year, 22%. At 2 years, 11%. At 3 years, 10% was clear zone positive. The older patients than 6 years old got the more clear zone were positive. Relationship between clear zone and bone union. Radiographic bone union rate was 97% at the final follow. There was statistical significance both at 6 months and 3 years follow. Relationship between clear zone and fusion procedure. There was no statistical significance between posterolateral fusion and posterolateral fusion with posterolumbar interbody fusion. Relationship between clear zone and the number of fusion levels. Although we have compared clear zone with various levels, there were only statistical significance in 1 level and more than 2-level fusion. Relationship between clear zone and reoperation. There was no statistical significance at 6 months, but there was statistical significance at 3 years follow. Case. The presence of 1 mm or greater radiolucent zone around the pedicle screw on the radiography was regarded as clear zone positive in post-operative 6 months. Clear zone around the pedicle screw disappeared in post-operative 3 years. Another case. Clear zone around the pedicle screw was observed at 6 months, but after 3 years, that was disappeared. This case was a wide-range posterolateral fusion post-spinal stenosis. Clear zone around the pedicle screw was observed at post-operative 2 years. In dynamic view, pseudoarthrosis was observed on L5S1. So we removed the metal and fixed the expandable screw and post lumbar into body fusion. Discussion. Bone resorption around the screw is associated with hardware motion, loss of fixation, non-union, and infection. The formation of lucency is thought to be gap developed by decreased fit. The gap in the screw bone interface can be disappeared with the decrease of intervertebral mobility by bone union. Non-union of spine is usually defined as failure of solid fusion at 1 year after surgery, because 6 to 9 months is necessary for solid fusion to be seen radiographically. The accuracy of X-ray interpretation for spinal orthodesis is only 68%. Dynamic views are more useful in evaluating the functional integrity of the fusion. Patients with posterolateral fusion showing 2 or more degree of intervertebral mobility were judged as pseudoarthrosis. 2/3 of the clear zone disappeared over time. The presence of clear zone did not necessarily mean pseudoarthrosis. Conclusion. Clear zone positive of early follow-up flame film especially do not necessarily mean pseudoarthrosis, but clear zone persisting during follow-up are high risk of pseudoarthrosis, so careful observation of follow-up flame film is required. Thank you for your attention.